So which one of the following pathologies is most likely demonstrated in this angiogram? Yes? Any guesses? Yes, any guesses? What is the type of aneurysm you are seeing here? Okay. So let me define the findings of this angiogram. So what you see here is the AP and the lateral view of the cerebral angiogram. So this is the lateral view. So what you see here is the ICA. You can see the ICA here, the carotid, the cavernous ICA. Then you are having, this is the ophthalmic artery. Okay, this is the ophthalmic artery. And here you are having an aneurysm here. So this appears as a supraophthalmic aneurysm. Okay, this is a supraophthalmic aneurysm. Similarly, this is in the AP projection. This is the ICA, which is then bifurcating into the medial A1 ACA and the lateral M1 MCA. And here we are having the supraophthalmic aneurysm. Okay, so this is a case of supraophthalmic aneurysm. So to understand the concept behind the supraophthalmic aneurysm, we need to know about the anatomical orientation with the paraclinoid aneurysms. So these aneurysms, they typically arise from the superior wall of the carotid artery at the distal edge of the origin of the ophthalmic artery close to the roof of the cavernous sinus. So at this point, the ICA changes direction from superior towards the posterior. So the maximal hemodynamic force is directed towards the superior wall of the carotid artery, just distal to the ophthalmic artery. Therefore, these aneurysms, they project upward towards the optic nerve and are often large with complex multilobulated shape. So hope this is clear. So this is based mainly on the hemodynamic orientation. So the aneurysm, the origin of the aneurysm is usually based on the hemodynamic hemodynamics. So usually at the ostium of the vessels, it is common, or when the hemodynamic flow is when it is maximum. So here we have an orientation which is changing from superior to the posterior. So at which point the hemodynamic force is maximum at this level. So we have an upwardly projecting aneurysm, that is the supraophthalmic aneurysm, and upwardly projecting supraophthalmic aneurysm. So surgical exposure may be difficult as the ophthalmic artery has a variable origin and course. So most of the time they are wide-necked aneurysm that may require remodeling techniques. Unruptured aneurysms may become symptomatic due to headache or compression of the cranial nerves. So now to understand the Van Leeuwen classification of the ICA, the supraclinoid parts of the ICA. So the three segments is the clinoid segments, the C5, which is between the two upper and between the anterior clinoid process, and then is the ophthalmic segment, and then the communicating segment. So we can have in this classification, we can have a normal ophthalmic artery course, or we can have an ophthalmic artery arising from the cavernous segment of the ICA, or we can have an ophthalmic artery arising from the clinoid segment of the ICA. So the paraclinoid aneurysms that I have, the two books have given two different types, but the orientation is almost the same. So this is in the Lawton's 7 aneurysm series, where they classify the paraclinoid aneurysm as ophthalmic artery aneurysm, superior hypophyseal artery aneurysm, and certain variant aneurysm. So in this variant aneurysm, we have the dorsal carotid, carotid cave, clinoidal segment, and ventral carotid aneurysm. So the same thing in the Human's textbook of neurosurgery, it has been classified as clinoid segment aneurysm and ophthalmic segment aneurysm. The clinoid segment aneurysms are further divided as anterolateral variant and medial variant. Okay, the anterolateral variant and medial variant. The ophthalmic segment aneurysms are further variants classified as ophthalmic artery aneurysms, superior hypophyseal artery aneurysms, and dorsal variant aneurysms. So to orient the anatomy, so first the bony anatomy. So this is the superior view and this is the oblique lateral view at the sella and paracella region. So this is the anterior clinoid process. So anterior clinoid process is an extension, is a triangular extension from the lesser sphenoid wing. Okay, lesser wing of sphenoid. So this is the anterior clinoid process. And this is the body of the sphenoid and where you have the sella and dorsomous sellae. And here is the optic canal. So the anterior clinoid process then continues as the medially as the planum sphenoidale. This is the planum sphenoidale. So when you see the same in the oblique lateral view, so this is the anterior clinoid process. So this is the triangular expansion from the anterior clinoid process, which is called as the optic strut. So the optic strut separates the superior orbital fissure and the optic canal. So it is a very important landmark. Actually, the anterior clinoid process forms a bony roof for the superior orbital fissure. And the optic strut is a funnel-shaped or a triangular bony expansion from the anterior clinoid process, which connects the lesser wing of sphenoid to the body of the sphenoid. And it also separates the superior orbital fissure and the optic canal. So